Yeah, I'd like to talk about this article I found in the journal Surgeries, Severe Attrition and Poor Patient Satisfaction in Patients Undergoing Telerehab versus Standard In-Person Rehab after Arthroscopic Rotator Cuff Repairs and Anterior Cruciate Ligament Reconstructions. What these authors did was look at patients undergoing arthroscopic cuff repair and ACL reconstruction and compared those that did regular rehab to those that did telerehab. All of the surgeries were done by 6 fellowship-trained sports medicine surgeons. They did actually 2 randomized controlled trials, one in those with ACLs and one with the people with rotator cuff repairs. They had a total of 60 patients, which supposedly met the power analysis they did ahead of time. And the interesting thing with this study was they really didn't find that much difference in when they looked at outcomes. The outcomes, whether they had home rehab, general rehab, or whether they had telerehab, were pretty much the same. The big difference that they found was, though, they had a large number of people they allowed them to either cross over from telerehab to the standard rehab or from the standard rehab to telerehab. And what they found was a large percentage of them went ahead and went over to standard rehab from the telerehab. No one went from standard rehab to telerehab, but a lot of people went from initially receiving telerehab to standard rehab. So they said patients, the outcomes is essentially the conclusions were that patient preferred in-person rehab compared to telerehab after ACL reconstruction or rotator cuff repair due to the crossover from telerehab to in-person rehab, suggesting that telerehab protocols maybe still need some refinement to be perfected. But I'm just really intrigued and probably need to look at this a little further. How come the telerehab people didn't really do any better than the people in the clinic? You would think the people in the clinic where you have more access to the therapist, more access to training equipment would do better than the people that just did the home rehab. Just wonder what your take is. Thanks for listening.